Over here, you see nurses, doctors with tattoos all over, with piercings all over.
Ghana, like, let me say it in Chi. Most of them are in Ghana.
This woman, Tech Hospital Children's Ward, I forgot her name. This woman, hey, she made my life hell just because I had put on makeup.
You know, I think he was suffering so much.
I'll never forget it.
Don't compare it to Ghana citizens because you are not spending the money.
You know what I'm
spending the money.
You said towards
Listen,
marriage
then,
and
I
any
get you.
other
Listen.
thing. Yeah, you can't say.
To me, the biggest difference is the advancement.
I thought you were going to say the money.
Oh, okay.
60 hours a week.
60 hours?
Yes. In
Why?
Ghana. Yes.
Yes.
And I was paid 900 Ghana cedis.
60 hours?
Yes.
12 hours times
Yeah.
5
Yes.
in Ghana.
Oh.
In Ghana.
Okay, so hi guys, welcome once again to my channel. My name is Nanelle. Okay, so I'm going to mention my name and then where I am in the UK and then what I do and then where I'm from. So my name is Nanelle once again. I'm from Ghana and I work in a care home in Northern Ireland.
Nanelle, I'm also from Ghana. I work in NHS Accident and Emergency in England.
My name is Justice. I'm also from Ghana, and I work in an NHS hospital in a theatre unit.
That's nice.
Yeah, my name is Daniel. I'm also from Ghana as well. And I also work at A&E in England.
That's nice.
My name is Susan, also from Ghana. I work in London at a mental health rehabilitation center.
So today we are going to compare nursing in Ghana and then in the UK. We are all from Africa and then we did do some nursing in Ghana and then we practiced here as well. We're going to compare nursing in Ghana and then in the UK, for those of you wondering. Okay, so what do you think are some of the differences?
Too many paperworks.
Too many paperwork
Talk.
in this country.
Hey,
No, okay.
like in my sector.
Oh,
Okay, so explain further.
We do with so much, paperworks that at the end of the day, sometimes you are not even able to spend quality time with your patients as you would like.
That's
to.
true for the
okay.
nurses. That's
We
true.
do a lot of paperworks,
That's
and
true.
that takes so much time.
That's true.
It leaves very little time, for you to spend with patients.
That's true.
Yeah, I think the paperwork that you're talking about, the documentation, those are things due to the litigation.
Litigation.
You know, in UK, everything they would sue you, so you need to document clearly what you did and what do so that you just protect your back. And it's like most of the time you don't spend much time doing what you're expected to do, but you spend so much time just covering your back.
That's true. Because when there's a fall in my care home, aside the fact that you have to do the normal GCS, whatever, you have to do an initial wound assessment, start an ongoing wound assessment, you have to do a doctor's, you have to write in the progress notes, you have to
take photos,
you have to phone the next of kin, update care plan, make a care plan for the fall, make a care plan for the wound, and this can take everything, and this can take you forever. So I think it's really true, the documentation is so much, and then like Danny said, I think it just has to do with the litigation issues. So what else?
To me, the biggest difference is the advancement.
I thought you were going to say the money.
Oh, okay.
Okay.
There is that money part, but
Okay.
we'll save that for last.
Okay.
I think the biggest the biggest difference is the advancement in the practice.
Okay.
Here, I think it's much more advanced
Okay.
than back home, of which it will not be fair to compare, but it's worth mentioning. That to me, that's the biggest difference.
Okay. Like, give us like an example.
An example is the things we have, the materials we have to help us do our jobs.
That's true.
Most wards have lots of, let's say, iPads
Okay.
to help them document all the vitals. In theatres, there are a lot of things, like I said. I mentioned about lap surgeries.
Mhm.
Here, there are instruments I never saw in Ghana.
That's true.
And it's like relearning the whole thing all together. So to me, the biggest one is
Advanced.
it's advanced here. Yeah.
Okay, that's
Can
true.
I chip in something?
Sure.
So one of the reasons why I came to you guys is because of the equipment and resources that is readily available. I still do enjoy the medical drama, and I saw that in the medical drama, you have everything you need to, be skilled and then to deliver your care.
Yeah.
But back home at A&E, there were some basic things that we didn't have, and 2 times I can recall that I cried because patients died. Yeah, patients died, and it was really frustrating because you wish you could have done more, but because you don't have those things, people die, and life becomes so cheap. So I was like, I have to leave, and I come here and I have job satisfaction because I have everything. You do your utmost to save the patient, and it's really satisfying.
PPH, postpartum hemorrhage.
Okay.
How it's managed here, it's so wonderful.
Wow.
In the sense that they have something they call a Bakri balloon.
A what?
Bakri balloon.
Okay.
So it's a balloon which they inflate with saline.
Okay.
So it inflates in the uterus.
Okay.
And then applies pressure to the vessels in there to stop the bleeding.
Oh, that's easy.
I never saw that in Ghana.
Wow. Is it like it's expensive?
To me, I never saw that in
We
my.
have
I
it
don't know
in
the
Ghana.
hospital you worked in.
Okay, I didn't know about it.
I didn't know about that. To be
didn't know
honest,
about
I
it.
didn't know about that until I got here.
I didn't know about that. That's good.
So
But I think it's even if they have in Ghana, it's only few hospitals
Yeah.
that will
That do.
have it.
Yeah.
But over here, everyone has everything.
Well, I have only worked in accident and emergency here, so I can only compare A&E in UK to A&E in Ghana.
Okay.
So I would say that, obviously we all train from Ghana, and if our form of training was not that best, first of all, we wouldn't have been employed here. So
Okay.
I think that we are trained well. It's just the giving out of the care that's the problem in Ghana, because we lack so many things. So for instance, in Ghana accident and emergency, first of all, there are not enough ambulances. So even if it's an emergency at home, they'll just put the person in a taxi. So
That's
the
true.
person just shows up at the front of the hospital in a taxi, and you don't know anything about the patient. Sometimes the patient is even unconscious, and he comes with a taxi driver.
Okay.
What is the taxi driver going to
To
tell
tell
you? So
you.
it's really difficult
Yeah.
to manage such things. But over here, ambulances are very common. It's like a taxi here. It's very, very common. And it's free when you call the ambulance. So
Yeah.
even before the ambulance brings the patient, they call, like if they are really, really sick, they call the hospital to say, oh, I'm
coming
bringing
with-
this patient, she's this years old, she's got a past medical history, blah, blah, blah. So you kind of have an idea of what is coming. So you plan ahead, because they'll give you a time, an estimated time of arrival.
Okay.
To say, oh, we'll be here in 15 minutes time. And so, like I don't know for other hospital A&Es, but in our A&E, we have a red phone. So that's the priority call red phone.
Okay.
And it's louder than all the other phones, so that when it rings, like wherever you are, you hear that phone is ringing. So it's most of the time the nurse in charge who answers that call.
Okay.
And then you say, oh, we're coming from here, 15 minutes time. This is the background. So then it's up to you, the nurse in charge, to decide with the consultant that, oh, then she can go to resource, she can go to the rapid assessment, depending on what the ambulance crew said about the patient. So it gives you like an idea to prepare before the person comes, to find a place for the person, especially for the patients that are on chemotherapy. They need to be in a side room. So imagine if they just show up and you don't have any side room for them. But here they make it easier, because oh, she's chemo, let's find a side room for her. So like you kind of
Prepare
put things
adequately.
in place before the patient comes. So even though you see it to be nothing, I feel it kind of saves life quicker.
That's
Because
true.
if the person just shows up, I've come, you don't, and and then over here, it's like, because of the GP system, wherever you are, if let's say you live in London, and then you come to visit a friend somewhere and you fall sick, you can go to the nearest NHS. The moment you mention your date of birth or whatever, they can still track and find your GP
Your medical
information.
history.
So
That's true.
it makes it easier, like
To
even
take
in
care
terms
of
of
you.
emergency. Because I think there was one day we had an emergency, the patient just collapsed in a town center and they called the ambulance, and she didn't have any relative, or so she was unconscious when they found her. And I think they went through her person, just found her ID card. and they brought that in. So the moment they typed their name in, we got to know of the past medical history. So it kind of help you to know what you're maybe.
That's true.
And that lady, she had a past medical history of.
But don't say it.
I'm just saying.
Okay.
I won't mention her name.
Okay.
I think it was problem with iron, anemia.
Okay.
So she has that problem. So it kind of give you the idea. Probably that's why she's collapsed.
So you know what to treat.
Yes, you know what to treat earlier. But in a situation where you don't know anything at all, you don't know where you're starting from, and you waste time. Okay. And then aside the ambulance thing, I think over here, because I remember in Ghana, after I think in the accident and emergency, when the patient comes, they go to red, green. They have some color system over there, and I think the patient
in Ghana we do have as well.
Then I'm talking about Ghana.
Okay.
And I think after they've seen the A&E team have seen the patient, and I think they stay on the accident and emergency for too long, or I don't know what they wait for, but sometimes they move patients out. I don't want to mention the name of the hospital, but the accident and emergency unit is, I mean, they are in different blocks from the main hospital, like the wards. So sometimes they stay there for too long, number one. And then sometimes I feel they are not fit enough to be moved to the ward, but they just move them.
For space.
Yes, for space. Because I remember there was one incident, I think that time I was a student. And I think third year or fourth year, you'd be asked to pick a student and a patient and case study, yeah. And then I had that patient, and at that time I was in the accident and emergency. And then I came back and they moved the patient to the ward. And I think the next day the patient died because she wasn't fit enough
to be transferred to the ward.
Exactly. But over here, what they do is that they have clinical site manager. So she is sort of looking up for the spaces available in the hospital, because most of the ward admissions come from A&E. So she's on the system to see, there's a ward space here, this patient is coming with a medical problem, she'll go to the medical ward, blah blah blah. And then in A&E you don't spend more than 12 hours, like it's such that within 12 hours you should be safe enough to go to the ward. So like there's a time limit to get things done properly. And if after the 12 hours it's not safe to go to the ward, we still won't force you to move because we need space. Okay. Like the doctor needs to say that, it's not safe, let's continue, that kind of thing. So I think it helps, because I remember in Ghana, in that A&E, you go there and then the patients are, sorry to say, but some of them are scattered on the corridor, and it's not because there's lack of space, but I think it's just because of lack of planning.
Poor management.
Poor management, yeah. So it makes everything, yeah.
I would like to also comment about the school in Ghana. Before we come here, we know a lot of things, and comparing with our colleagues over here that we meet on the wards or on the different units, we're able to do a lot of things.
That's true.
But you find people just being the first time they're able to insert a cannula and they're so excited.
That's true. That's true.
Even as a student, you do all those
true.
things, and you take so much responsibility as a student back home.
True.
And when you come out as a nurse, you graduate and you have your PN, you are fully equipped.
Yes.
To
But that one has its bad side as well.
Yes.
Okay, you when you're done.
And over here, I think the cons of the situation is also much more, because you find people starting working within the first 6 months or 1 year. They need lots of training before they can come to your level, and I think that's waste a lot of time, in my opinion. Yeah.
I think here they restrict. I don't know about. I haven't worked in NHS before, but from what I've heard, I think they restrict you. Like, look at someone like, let's say Justice. If he was suturing wounds back in Ghana and then he's able to do it well, when he comes here, he's not able to do it. And
you need to be trained and have competences.
No, he says even with that, like, it's just the doctors, the surgeons that do it.
I don't think it's like a restriction problem, but it's safety and then job description.
Yeah.
So a doctor is supposed to do this, and the fact that back home, or the fact that you can do it, doesn't mean you have to do it. Because before, when you came here, before your OSCE, we didn't work as nurses, and I think I think I was transferring a patient for a CT scan or something, and the patient needs to go on go with a what's it called?
Stretcher?
A suction.
Okay.
If she's blocked, because whilst you're lying flat, you may vomit, and they don't want you to vomit when you're lying flat, so you have to go with a suction. And I know I'm a nurse, I know how to use it, but because at that time I had not been trained, even if there's no one to go with the patient, then don't go with the patient. They won't compromise that.
I understand that, but I'm just trying to say that in that case, it makes some nurses in Ghana, like, how do I say it? Is it more skilled than some nurses here?
That is what it is.
Yes, because like a nurse in Ghana is like a jack or a Jill of all trades. She herself is a continence nurse, she's a diabetic nurse, she's a physio, she's what? Because, you know, if she's worked in this ward, she can suction, she can do this. She herself is a pediatric nurse. She can do in any situation that she finds herself. She can work.
I think it boils down to the training. You know, you are called a general nurse.
Yeah.
As a general nurse, you're supposed to be exposed to everything. Pediatrics, obstetrics, mental health, and everything, surgical, medical. So I'm a general nurse. I've been through all those things, all those training, and I've had clinical experience in all those areas as well. So I think it's a good thing. But over here, I think it's called adult nursing.
Yeah.
With adult nursing, you just do the basic stuff.
Yeah.
And that's related to sometimes care.
Okay.
If you want to go into critical nursing, that's a different part. If you want to go to pediatric nursing, that's a different part. But back home, general nursing, that's general.
You do everything.
Yeah,
everything.
You do everything.
It all has its advantages
everything.
and disadvantages.
Yes.
Because especially here, if you are not trained and because you do it because you think you know how to do it and something happens, you're going to push yourself into trouble. Yes. So
it's all about safety. Yeah. But okay, the good aspect is the fact that like a Ghanaian nurse will know how to do a lot of things than someone trained here, because from national service or whatever, even sometimes in school, you're taking blood samples, you're inserting cannula, you're doing stitching, you're doing all that. But here it's not like that. You have to be trained first, blah 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 before then. The money. Okay.
Yeah.
When I was in Ghana, I had not been posted by the government, so I was working for a private hospital and a private clinic, I should say, and I was being paid 800 Ghana cedis a month.
Oh, really?
800.
800
For how
Ghana
many
cedis a
hours?
month. But
I did 60 hours a week.
60 hours?
Yes.
In
Why?
Ghana?
Yes. And I was paid 900 Ghana cedis.
60 hours?
Yes.
12 hours times 5.
Yes.
In Ghana.
Oh.
In Ghana. Accra.
then it was 800 Ghana cedi equivalent in pounds.
It's
that's
120, 130 pounds.
No, it will be less than that now because a pound is now 7 cedis. Oh,
But still,
Yeah.
Roughly about 120.
Yeah.
About 120. That's how much I was making a month.
No, but
that's not what I'm supposed to get as a nurse in Ghana. But like it was a clinic, was it?
You can't also compare the money you get from Ghana with the money getting
Why?
because accommodate the cost of living in Ghana
It's cheaper.
is relatively cheaper and low. Over here,
Are you sure?
Yes,
Depends where you live.
you pay you pay like roughly about £1,000 or £800 for rent. You have to pay council tax. You have to pay a lot of things. So the amount of money you have to save.
But
then
I'll
regardless.
not let you finish.
Regardless.
If I was in Ghana now and I was working, number one, I wouldn't be living with my parents. And Ghana, they don't take the rent monthly.
Yeah.
So they take it
Advance.
2 years. 2 years. Where was I going to find that money from? That I've not rented, like I don't know how much they charge.
Sometimes we over exaggerate or we
Are you sure?
No. We overemphasize. Someone would think, oh, the gap is so much. But
It is.
it's
Danny,
not.
Then it is.
It is. It
Right.
is.
Then
I'm
regardless.
tempted to say this
Nanelle,
in G.
Maybe you're saying this because you're in NHS, but
not because I'm
Listen,
not from
the-
NHS, but and also Ghana, like, let me say it in G. Most of them in Ghana. Like, maybe I will ebusia like
Okay,
family wise, yeah,
family
okay.
pressure.
Now, when I
Do you understand?
they also send this
Exactly, 800 is what will they do for you?
Oh yeah, no.
That
Even if you want to get married,
800 is you can't
Listen.
say.
How do you
You
save
can-
towards
listen,
marriage
then
and
I
any
get you.
other
Listen.
thing?
Yeah, you can't say.
even if you are being paid £1,500 in this country,
You will
And-
still
and-
survive.
and you are paying rent and bills up to 1,100, and you only have 400 pounds left.
You will survive.
It's still better than being in Ghana.
You will survive.
Salary
you can
wise.
still save from that 400
salary wise.
and buy food.
400 pounds
Yes.
is above 2,000 cedis in Ghana.
Don't convert it to Ghana cedis because you are
Fine.
not spending the money.
You know why I'm
you are spending the money
Now,
here.
you know why I'm converting it back into Ghana cedis? It's because I've already paid all my bills, and that's cash I have in hand.
Even if you don't compare to Ghana cedis, if you're left with 400 pounds
to live for a month.
You can spend 100 pounds for the month, save
Exactly.
200
That's
pounds.
fine. That's fine. You are living in this country. You are spending your money in this country. So stop converting
I'm
the
not-
money
I didn't
all the
convert
time.
I get that point.
Don't convert
Yeah.
the money.
I get that point.
I
Yes,
didn't
I get that point.
So when you spend the money here and then you stop converting, it wouldn't be like, oh, I have so much money left with me.
No, but even if it's 400,
No,
it's
it's
still
Danny,
so
I-
much money. Even if it's
Danny,
400, it's still so
I-
much
I-
money.
It's
Are you-
still too
are you-
much money on you.
Are you trying to say converting it into Ghana cedis makes someone living in Ghana better than we are?
No, you think you have lots of money, but you don't.
But you do?
No, but even with the
No.
400 here, even if you are
It's
spending,
not
it's
something.
still a lot of money here.
It's still a lot of
It's
money.
still a lot of money
Convert
here.
It's still a lot of
Enjoy
money.
your
Still
money.
lots of money.
You'll be
It's still a lot
fine.
of money.
Stop converting and enjoy your money. That's it. But if you convert the money all the time, you think, oh, I have lots of money. But
And
if you want to shop for
Danny,
something,
even if you don't convert it, you are still fine
You're
with
still fine.
400.
Oh, yeah, you're fine.
400 pounds.
I'm saying you're fine. But the thing is, when people come, they're always converting to.
Danny, how much were you making? How much were you making in Ghana? First of all,
Oh, it was like
Something like
1,500.
1,500.
Me, I was
5,000.
making 900 cedis. 900 if I was paying for rent, or let's say pay bills at the end of the month. Sign a make sure and I send them the How much
Oh, I
I
get
spend?
you. See, and there is lots of pressure as well back home. People
So 900
looking up to you.
especially when you and then when you pick trotro in
no uniform.
your white uniform. When you give them mate, it's a 20 cedis.
I
How
get
say mate if I'm
See. I get all your points. The standard of living here is high, and
I don't see it to be high, honestly.
It depends
Well,
on the
yeah,
not the cost of living.
but the standard.
Standard of
Okay,
living
okay,
is
okay,
high.
okay.
Yeah.
So you have a lot of things. So back home it would take me like 2 years or to save like a whole lot of money before I can buy a vehicle.
That's
Over
true.
here,
That's true.
I just need my license and within some few months I can
Yeah,
buy a
Even
vehicle.
without money, you can still get a
But,
car.
yeah.
So far as they know that you have a good job, and then you have like your
So-
payslip shows that you have.
I was
Yeah,
telling
that's
my friend that I think she's British, and I was telling her, do you know why in Africa most of us are Christians? I'm not saying that's why I'm a Christian, but in Africa, if your relative is sick, or if you are sick and you go to the hospital and say, oh, you're coming to do this surgery for you bring this money, you have to fast and pray for months before you raise that money to buy a car. Your mother will have to go to the prayer camp almost every weekend to pray for you. So like everything is like, I'm not saying it's bad to be a Christian. I'm a Christian, but it's so bad that like
We've spiritualized everything.
yes, everything you have to pray. But over here,
You just work and then you make
you
it.
will never like. I don't know how to put it. Like imagine if you fall sick and you don't have money, you just go to the hospital and you don't pay anything for it. Like if you want to get a car, it's very easy. If you want to rent a house, they are not asking for 2 years deposit or 2 years. So it makes things easier and you are comfortable if even the little that you are earning. But it's not the same back
They're
home.
far ahead and everything
Yeah,
is
it's not the
well
same back home.
structured. So
Yeah, it's not the same
you
back home,
know,
honestly.
you wouldn't suffer so much
It's
to
not the same.
be able to
It's not
live
the
a
same.
comfortable life.
I'll say here they invest much into training
Yes,
the
it's
nurses.
very important to them.
Yeah, compared to where we come from.
Mhm.
In as much as you get the best training in school, when you come out, I think in-service training is very limited
Okay.
as compared here. Because here, I'd say every month you can be on 1 or 2 trainings each
Okay.
month.
Okay.
And
But there are workshops in Ghana as well.
there are, but how often is it? And how accessible is it for most of these nurses?
Okay.
But here, you can put your name up.
Yes.
They come to you, let you know what courses are coming up,
Exactly.
and then you let them know what you really want to
And
take.
you're even paid to even attend
Exactly,
the training.
to attend the training.
Makes it
So
attractive
it's
as
not-
well.
yeah. Because in Ghana, I wasn't posted by the government, so I don't know how they do it in the government setting. But while I was doing the 60 hours, I think
I think he was suffering so much.
Yeah. 60 hours.
I'll
that's a
never
lot.
forget it.
Yeah.
Because if I was doing 60 hours here,
Oh, that's a lot of money.
so So when I was doing the 60 hours, because it was a private set, I think they were not really concerned about you
Your
going
training.
for training, but the nurses were the ones concerned because they had to fill their logbook or something.
Yeah.
So to even ask for a day off to go and attend that training, it's
That was
even
problem.
it's
I
even a
think
problem.
they were exploiting and abusing you.
It's a private. It's a private
That's
clinic.
what most of the private hospitals do in Ghana. Like they abuse people. Like,
And that's what the care homes in this country also do.
it's not what they kill me.
No,
that
no.
Most of them, all they
Most
think
of them.
about is
Where you
for you
work.
to come to work. If you fall sick, so they'll call you. When are you coming back to work? That's the first thing they want to hear. When are you coming back to work? They'll not ask you, oh, how are you doing? What kind of treatment have you had?
Yeah.
The first thing, we just calling to see when are you coming back to work? That's all they want. That's all they just want their shift covered.
Yeah.
That's it.
I'll give you an example. I returned to the UK from Ghana on the
Okay.
24th of December 2019. On the 25th, I had a severe diarrhea, so I called in sick, and I stayed home for close to 6 days. Would you believe my manager didn't even call to check on how I was doing?
At the time you were in the care home.
I was in a care home.
Okay.
It never happened.
Okay.
But I came here in
Uh-huh.
this NHS. I had a twisted ankle from playing basketball, so I called in sick one day. The next day, they had to call to check how I was doing, not to ask if I'm able to come to work.
Okay. I think it's the individual differences. Like you're in charge in the NHS, and then you're.
Tell us about your care home.
I don't think.
Let's
I
know
don't-
your experience.
wait,
Have you called in sick before?
Wait, I don't think it has to do with care homes and NHS. I think
Depends
it's the
on the
individual managers.
Yeah.
You were fortunate to have a good one in the NHS. Maybe for all you know, at the back of her mind, asking you how you're doing, she's thinking, when is this guy coming back?
Fine, that could be the motive, but you don't make
Exactly.
you don't make it so obvious.
Exactly.
You see?
Okay. Some time back, I also felt sick. I think I had to leave work in the middle of the shift because I was so sick. I think it was diarrhea as well, and I left. When she called, she was first of all pissed. It's not my current manager though. She was first of all pissed that I left in the middle of the shift. I told her I couldn't bear it anymore, and then
Oh, Dara, you have to isolate
And then-
for 20
and then-
48 hours.
Yeah.
And then secondly, all she was concerned about was when I was coming to work. That's true, but I still think that it doesn't have to do with the care home or the NH. I think it's the individual person.
I personally think it's the care home. That's me. Nothing will change my mind about it.
They just exploit people.
They
Okay.
exploit, overindulge you, and then they will just loot you.
Okay, now let's talk about the different disciplines in the nursing or in the healthcare system of the UK. There's a TVN who's responsible for wounds and whatever, the skin conditions and whatever. There's a continence nurse, there's a diabetic nurse, there's a speech and language therapist. Like, they have so many disciplines. When they say multidisciplinary team,
Yeah, it's
they
an
really
interest,
mean
yeah.
a multidisciplinary team. Like, I don't see the same thing in Ghana. You have like the same nurses and the A&E. Maybe on the Tuesdays, if it's the whatever, the diabetic, the day they meet their diabetic clinic, then one of the nurses will go there and then do that. If it's the urinary whatever, that's when one of the general nurses will go there. But here it's really diverse. Like, you always have to refer to somebody who's a specialist in that area, and I think it's really good as well, because the person, although may have had like general training, the person has been trained specifically to tackle such issues, and then it's best in that field, and it's able to help, and then it makes the work easier.
I think the question you have asked will answer what we were debating about, that a Ghanaian nurse is more trained to do.
What sort of things?
Yes. Because then I will say that over here, from the start, they all, like, even if you're an adult nurse, you're all doing the same thing. Then as you are climbing up, they divide. Because I remember when I started, they asked me, what do you want to be in future? I said, this is what I am doing. They said, no. They sort of, they don't want you stuck at one point.
You want to know your career path.
Yes, what do you want to do? So if, let's say, you say, I'm interested in tissue viability or whatever, then they'll say, okay, then you can go and do some shadowing courses with a tissue so on your off day you can go and work with her, but not like you're not counted in the numbers, you're not responsible for anything, you're just working to see supernumerary, to see if you would like it.
Shadowing.
And if you come back and say, no, I want to, so they sort of push you like to try other things. Yeah. And that's how come we have the multi disciplinary whatever. Yeah.
Okay, another thing is I think this place they accept some things like socially, like in Ghana, a male nurse cannot perm the hair. Like I remember back when I was in KUST. Hey, I was saying this thing. There used to be a guy who was doing service with us. He's like a musician. He's called Script T. He's into music, yeah. And then he used to perm it. Say it's not like he had even dyed it. He had cut it normal, but he had just permed it, so it was a bit like spiky, curly. This boy was called to the manager's office every time just because he had permed the hair. Over here, you see nurses, doctors with tattoos all over, with piercings all over, dressed anyhow. They are doing their work. They know what they are expected to do, and they are doing it. And then everybody's okay with that. Nobody calls them to the NMC or the manager's office for anything.
Even though, like, you're saying that over here, but they still have the code.
There's a dress code and everything.
Yeah, but you
like,
still have to follow it, even if you've done your tattoo.
No, that's somebody with a tattoo showing. Can the person practice as a nurse?
Well, in Ghana, they won't
No,
let
they
you
won't.
do it.
Meanwhile, which people are we learning from?
Yeah.
We claim we are learning from this, so we want to be like them, but they are not as acceptable like these people.
Now, I think that what most managers in Ghana need to understand is what the person has to offer, not how they see it or how they present themselves.
If I tell you what I had to go through just because I went to work with eyebrows and then makeup, there's this woman, Tech Hospital Children's Ward, I've forgotten her name. This woman, hey, she made my life hell just because I had put on makeup. She just could not bear it. Come and see this place. People wear like eyelash. You see, like, and that one I think is just Ghana, because you know my friend Pauline. She dyes her hair red. She dyes her hair blonde, and then she says in Zimbabwe it was acceptable as a nurse, and she was an in charge. You can't do the same here. I only cut my hair, and then I was insulted by the nurse manager just because I cut my hair.